The opinions expressed are those of the show's host and not the staff or management of Port St. Lucie Broadcasters. Any reproduction without written consent of WSTU and WPSL is strictly prohibited. Now it's time for Quality of Life Radio, brought to you by Cigna and Aetna Medicare. Here are your hosts, Gary Owen and Tom Bouvier.
Hello and good morning, everybody. Thank you for tuning in to the world-famous Quality of Life radio show. It is December 19th, and that means 6 more days before Santa gets stuffed in the chimney and delivers all those wonderful gifts and presents for everybody. Thank you for joining us on this extraordinary Tuesday morning. My name is Gary Owen, and I am the host of the Quality of Life radio show.
And I'm your co-host, Tom Bouvier.
And Tom and I are extending each of you a very, very Merry Christmas and Happy Hanukkah, Happy New Year, Happy Kwanzaa, all that wonderful things. The joy is out there. The spirit of love and the spirit of hope is there. And we extend it to all of you, and we appreciate you joining us on this morning's show. And Tom, we're here every single Tuesday morning because we're missing our fun elf hats and Santa Claus hats, and we're not dressed in red and green today. We're not wearing our
Can
bulbs.
we wear them the day after Christmas?
I guess we probably have to make up for it somehow.
Yeah, I wish we had it, but anyway, Gary, we are here every Tuesday morning, and we appreciate you listening in every Tuesday morning at 10 a.m. on WSTU and WPSL, as well as the other venues that this broadcast is. We bring quality information about insurance planning that you will not get anywhere else. We bring straight talk, transparency. We call it the no plop zone. We're going to give you the information from all different sides in a fiduciary way, and that's just a fancy word for saying in what's in your best interest. Because the goal at Owen Insurance Group is to increase your quality of life and to simplify the insurance planning so that you can live a stress-free life. Because once you get your insurance planning and all your insurance needs set in place, boy, it brings a great relief to you. I know so many things I've done in my life. Once I know I've gotten that thing off my plate, boy, peace of mind. Just be able to live the stress-free life that you deserve. And that's what we do at Owen Insurance Group.
That is our mission. That is our goal. That's our mantra. It's just not buzzwords. These are taken to heart, and we want to make sure. Tom, I feel that we are the beacon of light in the dark night as the sea and the tempest of the waves is crashing, and all these Medicare beneficiaries are getting the relentless calls, 48 to 50 calls a day some people are getting, especially during AEP this past couple of weeks. It's crazy. It's against the law. Those of us, Tom, you and I abide by the rules and regulations by the letter of the law because that's what we do, because we have integrity. We want to do the right thing. And unfortunately, there is a lot of bad actors out there, nefarious players who are going to try to enroll you in a plan, and maybe they will. Maybe you call and say, "No, I'm no longer interested." And we getting people saying, "Hey, somebody enrolled me in this plan that I never thought I was going to be enrolled in. I didn't ask to be enrolled in this plan." So this is what's happening out there. Be careful. Be cautious. Again, we always say work with a local Medicare agency, somebody that has credibility, has been doing it a long time, somebody that you can go physically see, go look up. If you're calling a call center, come on, people. Do you know what you're doing? Do you know what goes on in these call centers? I know you don't. So, and we're not going to take the time today to go through that, but I'm going to tell you right now, it is not in your best interest to call a call center to get your Medicare. That is not the right way to go. You need to seek out, I don't care if you're already on Medicare, if you're turning 65 and you need help and guidance, don't call Medicare because they have no idea what's going on themselves. Number 2, work with a local agency or an agent that's independent that can be your guide, take you by the hand, educate you, be transparent, provide you all the information that you need so you can make the choice that's best for you. Tom, what am I missing?
You're not missing anything, Gary. In addition to everything you mentioned, you can actually vet insurance agents. Just ask them some simple questions.
Right.
Well, go if they have a website or they online. You can look at Google reviews. You can ask other people what their experience is. Ask that agent, how long have you specialized in Medicare? Do you represent only one insurance company? If they say, well, oh yes, I only represent the best, and we only have, that's a captive agent. They can only provide service reviews and enrollments in one company. You don't want that. You want an independent insurance broker who has years of experience, who's helped thousands of people, hopefully, and they know their stuff. And they have good reviews, and you don't feel like you're being talked down to or that you're being pushed and steered into a plan that you're without a thorough conversation. I like to say it's best to have a conversation, not interrogation,
Yes.
to find out what a client's needs are. And so that's what we do at Owen Insurance Group. We just should simply have a conversation. All your needs, get providers, doctors, medications, everything, and then we find the plan that's best.
Yeah,
for them.
it's important that we conduct a honest, thorough needs analysis to determine what is the best fit for you, because there is not a one-size-fits-all solution. Case in point, today, we had an agent that was with a captive company. I won't mention the company by name, but they have green in their color, and she got sick and tired of only being able to represent one company with one plan, right? So it's important that you have diversity and resources, and that's what Owen Insurance Group provides. So anyway, let me digress. Let's get to the today's meeting about prescription drugs and government intervention. But before we do, let's give the quote of the day today. Forget the failures and trials of buried yesterdays. Do not frown at the unborn fears of a future tomorrow. Concentrate your best efforts to succeed today.
That's
is
great.
Your quote of the day. All right. So, Tom, you and I, when we talk to clients, I think the number one issue that people are concerned about is
prescription
drugs.
It really is.
It's horrific to see what's going out here with the cost of drugs. I am thankful that that the drug conversation is happening with the government and these drug manufacturers. In the United States of America today, the cost of drugs outpace and outprice any other country in the world. It's ludicrous. It's ridiculous, and it needs to come to an end. So there's some things happening in 2024 where now there's a cap on the catastrophic phase of the Part D, on phase 4 of the Part D drug plans. So no longer you're going to have to continue to pay in perpetuity once you're in the catastrophic phase. So there now it's capped, and we've done the math, and we believe that in 2024, no matter which drug plan you're on, that with the co-payment, the deductibles, the payment from the manufacturer, the PBMs, the plan and sponsors, that you should not pay more than about $3,800 to $3,900 per year in 2024. Thank God. In 2025, that number, your max amount of pocket in 2025 is going to be $2,000 on prescription drugs. There is some relief coming. There's some relief coming.
And folks, please understand that historically, you may think that the government has always been involved in prescription drugs with Medicare. But when Medicare started in 1966, there was no Part D prescription drug plan. And when Medicare Advantage plans began in the 90s and maybe a little bit before that, but Medicare prescription drug coverage from the government through Medicare did not come about until 2006. So that's really not that long ago. Previous to that, Americans were on their own. So now to hear that they're only going to have a $2,000 max out of pocket or for 2025, it has come a long, long way. And of course, that's a lot of money that through Medicare and the government's going to be having to put up. So we'll see how that works. I'm a little
Yes,
I'm
obviously,
hopeful but skeptical.
As I said before, and I'll say it again, is that Inflation Reduction Act with the prescription drug front has caused some unintended consequences, like rate increases in the premiums for the drug plans. But again, as we mentioned on last show, that there is one certain drug plan that's $0 premium. So that's why it's incumbent upon you, our listeners, all Medicare beneficiaries, to call Owen Insurance Group to get an unbiased review of your current plan, or if you're aging into Medicare. All you have to do is pick up the phone. It's very simple. It's like you pick up the phone or dial your cell phone and dial 772-210-1020. The phone will ring, and you'll hear a very friendly, pleasant voice. Answer the phone and see how we can help you. Very simple, very easy. All right, so we're going to talk about the Biden administration on Thursday opened the door to seizing the patents of certain costly medications from drug makers. What? They're seizing the patents of certain costly medications from drug makers in a new push to slash high drug prices and promote more pharmaceutical competition. The administration unveiled a framework outlining the factors federal agencies should consider in deciding whether to use a controversial policy known as march-in rights to take patents for drugs developed with taxpayer funds and share them with other pharmaceutical companies if the public cannot reasonably access the medications. Doing so could lead to the development of lower-priced generic alternatives, which could cut into key drug companies' profits. Oh, instead of making $18 trillion a year, they might make $8 billion a year. And reduce cost for patients. For the first time, officials can now factor in a medication's price in deciding to break a patent.
The administration will make it clear that when drug companies won't sell taxpayer-funded drugs at reasonable prices, we will be prepared to allow other companies to provide those drugs for less. Political pressure has pushed healthcare companies to launch their own efforts to lower drug prices. CVS, for example, on Tuesday unveiled a new prescription drug pricing model which could potentially cut costs for patients at the pharmacy counter.
And Tom, I don't know if you follow the stock market or not, but did you see what happened to CVS's stock prices when this got announced?
I did not.
Crazy went up. It went
That's
up.
Nice.
Yes, it has gone up. So it's a win-win for everybody, in my personal opinion. I'm not talking about the stock market, but it's great for the consumers when there is competition. Nearly 3 in 10 Americans struggle to pay for the drugs they need, according to a July survey from health policy research organization KFF, which is the Kaiser Family Foundation. And some research suggests that U.S. patients spend about $1,200 more per person on prescription medications than those in any other nation. Yet, taxpayers have spent tens of billions of dollars to fund hundreds of drugs in the last decade, which the Biden administration believes could justify more government action to cut prices. The administration's new push is to use march-in rights, could eventually have major ramifications for the pharmaceutical industry, which has long argued that the policy discourages research and development of new drugs. I call bull hockey. But anyway.
And drug makers have argued that seizing the patent for a medication makes that treatment vulnerable to competition, which can reduce the company's revenue and limit how much it can reinvest in drug development. Now, that pushback has made the federal government reluctant to use march-in rights in the past, which has frustrated progressives on Capitol Hill. On Thursday, Senator Elizabeth Warren told CNBC that the Biden administration's new framework is using the right approach overall, which is to use every tool in the toolbox to bring down drug prices.
Now, Tom, I have not heard from one single client that they want to pay more in drug prices. I've not heard one client ever say, Gary, I don't think I pay enough for my drugs. Quite conversely,
Correct.
what
Quite
we hear
conversely.
is that it is too darn expensive and I can't afford most of these drugs. So anyway, then when there's no competition in the market, then that falls hard on people who need that drug. It also falls hard on taxpayers who end up paying for it through other government programs. The senator added that march-in rights have existed in the law for a long time, but that power hasn't been picked up and used very aggressively, like many other laws, quite frankly. So she is glad to see the administration move in that direction. Meanwhile, the pharmaceutical industry's largest lobbying group slammed, of course they did, the Biden administration's push to exercise march-in rights in a statement.
And so this would be just another loss for American patients who rely on public-private sector collaboration to advance new treatments and cures, said a spokesperson for the Pharmaceutical Research and Manufacturers of America, which represents drug makers such as Pfizer, Eli Lilly, Johnson & Johnson. The administration, they say, is sending us back to a time when government research sat on a shelf, not benefiting anyone. Both the Obama and Trump administrations had rejected march-in requests from lawmakers and patient advocates. The Trump administration even proposed a rule that would prevent the government from exercising the policy based on the high price of a drug alone.
And the Biden administration chose not to finalize that proposal earlier this year, according to release from the White House on Thursday. But the Biden administration has also shied away from using march-in rights up until now. In March, the administration declined to break the patent of the costly prostate cancer drug Xtandi from Astellas Pharma and Pfizer. The drug makers charge, get this, Tom, more than $150,000 a year for this prostate drug in the United States before insurance and other rebates, but charge a fraction of that price in other developed countries. Why do you think that is, Tom? Why is it that they think the drug manufacturer is going to get away with charging a drug $150,000 when we could go to another country and get it for a fraction of that cost? What's going on here? Is it greed? Is it just simply greed?
I think they know that they have the American consumers over a barrel, and they can just charge us whatever they want. And these type of laws are not in place here, protecting the consumers. And they know other countries are not going to buy it, and so, but they can make it cheap enough to give it to them at a lower cost. And I know people who actually fly. They will fly to another country. I have clients actually that do this.
Yes.
They say, I have some very, very expensive medication. Even with my drug plan, I fly to, one flies to Germany, gets like a year's supply of it, comes back, and they save enough money. Yep. It costs for their flight, for their time over there. They have a little vacation. They have a little vacation. They come back, and they still pay $10,000, $20,000 less on these very expensive medications. So I don't know the 100% the reason why, but it's really somewhat crazy. So the Biden administration has attempted to lower drug costs in other ways, which is good, such as giving Medicare the power to negotiate drug prices for the first time in the federal program's 60-year history as part of the Inflation Reduction Act. Now, I was blown away when I read that because, quite honestly, I heard about that. I used to hear Medicare can't negotiate. I didn't know exactly what that meant, but then I began to study and read, and it's unbelievable. And that medication you mentioned, Xtandi, was excluded from the first 10 medications the government selected for negotiation, which prompted Astellas Pharma to drop a lawsuit it filed to halt the price talks. Also on Thursday, the Biden administration unveiled efforts that aim to counter allegedly anti-competition laws by big healthcare companies.
And then finally, some target private equity firms which have been buying up physician practice. We see it every day. Physician practices, nursing homes, and other healthcare providers. Private equity ownership in the healthcare industry has ballooned, with approximately $750 billion in deals between 2010 and 2020, according to a report from the American Antitrust Institute. The administration is concerned that corporate owners are maximizing their profits at the expense of patients and their health and safety, while increasing costs for patients and taxpayers alike. So that is what's going on in the world today. Consumers, Medicare beneficiaries who are on prescription drugs, and many of it is essential to maintaining a quality of life and to maintaining life itself. And when these drug manufacturers are using taxpayer dollars to fund them, and then also they're charging $150,000 a year for a life-saving drug, I just sit there and scratch my ever-loving head. I just don't get it. So I'm thankful. Listen, I don't care what line of politics you're on. I don't care if you're red. I don't care if you're blue. It's not about politics. It's about quality of life, quality of health, being able to afford. There are so many people struggling out there today, struggling to make rent, struggling to pay their mortgage, struggling to pay their health insurance premiums, struggling to get the prescriptions that they need. So I know that we're passionate about this. We're passionate about because our clients, Tom, are our family. We care about our family. We care about our clients, and we will fight tooth and nail for our clients. In fact, being a member of NABIP, the National Association of Benefits Insurance Professionals, I am proud to say that we're excited that when we go to Washington, D.C., typically February of each year, and we talk to our legislators about what's going on. We tell them what our Medicare beneficiaries are saying, what their constituents are saying, the problems we're having, and how the laws and the rules need to change. That's what this organization is about. We give back to our industry that gives to us, and we are very proud of our industry. And yes, Tom, we know there's a lot of bad actors in this industry, and I am proud to say that the Owen Insurance Group agency, with over 500 agents across the state of Florida, Virginia, Texas, and California, and Alabama, and Georgia, and South Carolina, and so forth, we are here to represent you. It's our mission because we are independent agents, and we are here to support you every step of the way. Let us be your resource, Tom.
Absolutely. And since we're talking about prescription drugs, Gary, I want to bring up something that we talked about last week. We talked about the special enrollment period. So potentially you're out there, and of course December 7th is over. It was gone 12 days ago. And you did not make a change in your prescription drugs, but maybe you just got on a new medication, or you didn't do the annual review of your prescription drug. You have a Medicare supplement, you have a prescription drug plan. There is what's called a special enrollment period. Again, from last week, we talked about special enrollment period. So if you did not make an election, you didn't make a change in your prescription drug plan, and you missed that open window called annual enrollment period, give us a call. We can talk to you about a potential opportunity for us to review your medication list, see what drug plan you're on, and possibly get you on a drug plan for January 1st. So there are some open windows due to disaster, special enrollment periods, et cetera, in the state of Florida. Many states have those as well, but particularly in the state of Florida, give us a call, and we could look at your prescription drug plan and potentially make a change for next year.
Yes, and it just doesn't have to be January 1st either, Tom. I mean,
that's true.
So,
actually,
a client wants to wait till January. I mean, we know it's a holiday season. You're busy, you're traveling, whatever. We can make it February 1st or even a March 1st effective date because some of these SEPs will allow you to make a change up through March 31st.
Oh yeah,
right?
March 31st.
Yeah.
So even exactly. So thank you for clarifying.
And then also one last thing before we go is if you are calling and you want to know more information about that $0 drug premium, we always say don't look at the cost of the premium. Look at the overall cost. If you're not on prescription drugs, or maybe you're on just generic drugs, yes, that $0 drug premium would probably be beneficial for you, and it's a great fit. But it's not a great fit for everybody. So don't get enticed by the $0 premium because the formulary, the drugs that you're on, may be higher tiered, and it may cost you more than, say, a drug plan that might be $44 a month. So again, call the experts here at Owen Insurance Group. 772-210-1020. It's December 19th. Christmas is right around the corner. Tom, I wish you and your family a very Merry Christmas.
You too, Gary.
All of you,
Thank you.
a very Merry Christmas, Happy Hanukkah, Happy New Year. And stay tuned. Coming up next is a Brian Kilmeade Show. Thanks for tuning in this morning. We appreciate you being with us. And remember, Treasure Coast, stay safe, keep healthy, be happy, and enjoy your quality of life.